Hello, I'm Dr. Jeffrey Kile.
And I'm Dr. Alvaro Reymunde.
And today, let's talk about dental health in children.
Yeah, I think that's a great topic. And one of the main concerns, or I guess questions we get in the office is, when should I start worrying about my kids' teeth? When do I start brushing?
Right.
When do we start using fluoride, and how do we start using fluoride?
And I think there's been a big thrust now in pediatrics in general, and how important care of the teeth are, because we're starting to view dental caries and cavities as infectious diseases.
Definitely.
Really. And I think now that is one of the most common
chronic infectious disease of childhood is early childhood cavities, and that's a really important thing to be aware of, because caries or cavities can actually lead to dental abscesses. And in some cases, very severe cases, you can actually get an abscess that shoots up to your brain, and it can cause meningitis. It's not common, but it is definitely possible. It has been seen before.
Sure.
So it's really important to know and to learn how to take care of our children's teeth appropriately.
Correct. And parents and family members who have chronic dental problems, that can happen in their children.
Correct.
So it's important that everyone cares for their children's teeth.
Right.
So let's talk about when that first tooth comes out, and when we have a baby and toddler, how do we care for those?
Right.
teeth?
So usually the first tooth erupts around anywhere from 4 months of age till about 6-9 months of age. And when we see that first tooth, all we really want to do is start brushing it with either the finger toothbrush that you can put on your finger, the sleeve, or just a little brush. And you can just use water with that, and that's fine. Once you start getting a little bit more teeth, 6, 9 to a year, then we can maybe start using a little bit of toothpaste on it. And we really only need to use a small smear of it.
Yeah, they're saying like a rice grain amount, so like a really small amount. But the key is that it is fluoridated toothpaste.
Correct.
So even if the babies, they can't spit it out, that's why we use a small amount.
That's why we use a small amount.
And think about rubbing it into the brush, right? So
Correct,
they can't swallow it.
Correct. And even if they do swallow a little bit, it's such a small amount that it's perfectly fine. Now, being that children at these ages visit the pediatrician so often, every few months you're coming into the visit, it places us at an advantage to help remind parents to take care of their children's teeth, and also to provide fluoride varnishes. I believe, at least in our area, most family dentistries will start seeing children closer to 3 years of age.
That's correct.
And there are very few that will see them younger than that. So
unless you're seeing a pediatric dentist.
Correct, unless you're seeing a pediatric dentist. So it really falls on the primary care provider's responsibility to take advantage of that. At Pediatric Associates of Kingston, we do provide fluoride varnishes for children. And we can start that as early as 4-6 months of age.
Right. And really the goal of that is to help protect the teeth from becoming decayed or getting cavities. And it's a very simple procedure. We just sort of paint it on the teeth.
Yeah, with a little brush we just paint it on, and it makes that enamel a little bit harder. And now it's important to realize that is in addition to the oral supplement of fluoride that you take in a vitamin. So you should really be doing both,
right.
The daily fluoride, and then the topical fluoride that you paint on your teeth. You could do it, depending on family history, anywhere from every 3 months to twice a year.
Right, exactly. And fluoride supplementation that we give to children is really important, because in our geographic area, most communities don't have fluoride in their water supply.
Correct.
So like many other areas around the country where there's always fluoride in the water that people are ingesting all the time, we don't have that, so therefore we have to supplement it.
Correct.
And I often get asked the question, well geez, we're doing fluoride toothpaste, we're getting fluoride topically on our teeth through the use of the fluoride varnish. Why do I have to take fluoride and ingest it? And really, they work different ways. So topical fluoride works differently in your body than when you take it internally. And so you're not overdosing yourself on fluoride. And like fluoridosis, really.
Right. So fluoridosis.
Comment on what that is.
It's not really that common. So fluoridosis is actually a side effect of the supplement of fluoride that you take if the child is taking too much of it. you cannot get fluoridosis from toothpaste or from the varnishes that we apply. That's why we, as pediatricians or your dentist, will make sure that your child is getting the appropriate amount of fluoride in that supplement, and that's dependent on, number one, how much fluoride is available in your regular water, in your tap water, and two, what other sources of fluoride you might be drinking. For example, there are some bottled waters that also have some fluoride in them. So we have to take into account all of those things.
Right. And the key point to remember, in communities that don't have fluoride in their water supply, which again most communities in our area do not, fluoride supplementation through ingestible fluoride, or fluoride that you take by the mouth, is recommended by the American Academy of Pediatrics. It's also recommended by the American Dental Association.
That's correct.
So we're following the guidelines that are very well established by large healthcare organizations.